Above all, New Orleans is a city that loves to celebrate. And right now, there is no greater joy than when a patient beats a killer virus. But Administrator Dr. Eric George introduces us to the other side of this pandemic at Omega Hospital.
We're entering the COVID unit now.
A rare, unvarnished look at life and death as doctors and nurses fight a disease they know little about.
I guess deep down you just felt like it was your duty to do it. Yes, I was afraid. I don't know. I just put all the stuff on and just went in. I don't know. And then you see the people and you feel sorry for them and you just do what you have to do.
And you guys have been doing this now for how many weeks? 3 weeks.
Omega is what is known as a Tier 2 hospital, usually performing outpatient surgery. Healthy patients come in, have the surgery, then go home.
And then now you're going to need your 2 pair of gloves. Okay?
A little bit tighter.
Right. You see why the mirrors are coming handy.
But the nurses helping me with the personal protective equipment suddenly found themselves dealing with life and death as the crisis pushed New Orleans area hospitals to the limit. And it became a question of finding beds for the very sick.
How you doing, baby?
For the very ill, this is the only human contact they have.
Yeah? Okay.
Caring nurses and doctors.
Can I get anything for you?
Her prognosis is grim. An 80-year-old nursing home patient with a DNR order, which means do not resuscitate.
Dr. George, one thing that really stands out to me, we've seen a lot of images of empty streets and empty buildings and empty schools, but this is COVID-19.
This is it. And it's when you tell patients and you tell people out in the public to be cautious and be careful, this is a real disease. And if you don't take care of yourself, the people, the young people who can transmit this to elderly or immunocompromised patients, and this is what you do to them.
Mostly they try to make her comfortable. Breathing is labored, and pain medication comes as often as possible. What hurts the staff are demands to reopen the United States, to push for business as usual and make it happen now.
And all they need to do is spend a minute in this room. It is absolutely the most frustrating for all of us in healthcare. We say to ourselves, our nurses come and they say, I can't believe that people ask us, is this disease real? Is this all...
Like all other medical facilities in the area, Omega was pushed to the brink.
We've buried 4 of the 11 patients that were in this center. We have buried. And what it says to us is we need more testing. We need more knowledge of this disease before we turn people loose.
No, that's perfect.
These are the ones carrying most of the emotional baggage. Nurses working long, difficult shifts and say they have not had time to process the mental anguish of so much suffering and death. And they all have stories. For Lee Nagy, it's the 100-year-old war hero.
He was one I cried for, because he was just, I heard he was a World War II pilot. I mean, he was a super cool guy, but he never bragged about it. All he said was, I'm a lucky man. Y'all are taking wonderful care. I'm so lucky to be here, and he was special to me.
The nurse in charge, Kelly Hodge, has had a difficult few weeks. One of her nurses died from COVID-19.
And so the last conversation I had with her, she could hardly breathe.
There is also the heartbreaking case of an elderly woman who contracted the coronavirus in a nursing home. But the tragic aspect is she did not need to be in the facility.
She had a shoulder surgery done, and her poor little husband couldn't take care of her, so he sent her to the physical therapy inside of the nursing unit, and she was going to be there for 30 days. On day 28, she spiked a fever.
The hospital was granted an exception, and husband and wife were reunited here one last time.
So we called this poor little man, and it's terrible. He's like, y'all answered my prayers, because he got to see his poor little wife before she died. And she died shortly after he saw her, because I'm sure that's what she was waiting for.
What's really sad, Sean, is we're not allowed to have family members come in with these people. The only people they spend their last breath holding hands with are our compassionate nurses.
Not long after this interview, the 80-year-old lost her battle with COVID-19. Not a statistic, but a terrified and frail patient who battled overwhelming odds. Someone doctors and nurses want you to remember. Sean Caleb's CGTN, Metairie, Louisiana.